Welcome to Behavioral Health Champions, where we engage in conversations with members of the state legislature and other stakeholders about how California can lead the nation when it comes to providing parity in behavioral health across the state of California. I'm Kevin Riggs on behalf of the Behavioral Health Action Coalition, which is really designed to come up with better awareness for the issue across California, to reduce stigma, and to assign a higher priority to this issue, again, across the state of California. We're in Fullerton today, and we're fortunate to be joined by Assemblywoman Sharon Quirk Silva. Welcome. It's good to see you.
Thank you so much.
So let's talk a little bit first about your background. You were a school teacher for a number of years. In fact, I guess in some ways you still are, because you're on leave from the district you taught at for a long time. Give me a sense for how your experience in the classroom has shaped your views as you headed to Sacramento, especially as it comes to behavioral health.
Well, I think as a young 20-year-old, as I entered teaching more than 30 years ago, we all go into the classroom wanting to teach, reading, writing, math, but over the years and decades, we really evolve into learning more about the families, learning about how many issues can impact the family, and especially my later years of teaching, where we actually went through the economic downturn, really starting to focus on helping families, whether it be with housing, whether it be with counseling, all of these type of connections through the community that could, in return, make their academic success more successful.
And so you saw a lot of these kids firsthand who were dealing with issues maybe at home, maybe a lack of support. Those were issues that really affected their learning. And so there were some behavioral health, issues. I hear about a lot of kids today who are diagnosed with depression, much more than ever before.
Yes, I think teaching elementary school, you see a lot about kids are much younger, and so some of the issues you might see in high school, junior high, we don't always see, but we also see what's happening with the families. Parents also are willing to share more than they might with older kids. So some of the things that might start young with behavioral issues in the classroom, learning issues, were something that I definitely knew were not just a single issue, but more of a holistic issue. So as I moved to state assembly, those were very important issues that I wanted to continue to work on.
And I wanted to ask you about that transition. So you were in politics at the local level. You were mayor of Fullerton before you went to the state assembly. What was it, if you think back, what was it that got you interested in moving into that arena, into civic life, into running for public office and serving as an elected official?
Well, I had a unique opportunity as a teacher on special assignment to be a chair of what we called the Fullerton Collaborative. And that was many agencies coming together to work directly with the schools, everything from eyeglasses to students, to trying to get counseling if we needed, working with the local hospitals, working with public safety to make sure that our neighborhoods and so forth were safe. And as I was in that role, I learned that academics, of course, is very important, but when you can really work on multiple issues, that family and student have much more a chance of getting to where we want them to be. So we continue to focus on that as an assembly office.
So the Fullerton Collaborative, that was a gathering of different types of organizations and representatives across the community?
Yes, and it's still in action today with many, many partners, including Cal State Fullerton, St. Jude from Fullerton, the Fullerton Elementary School District, along with many nonprofits working on homeless issues, tobacco issues, vaping. So they meet monthly and kind of put their heads together to look at solving big issues.
Is that a unique model? Have you seen other communities do this?
There are more and more collaboratives out there, actually, now that I'm really working very specifically on homelessness and working on issues that are related to housing. There's housing collaboratives, there's addiction collaboratives. Orange County has quite a large list of people really trying to support and focus on, for example, veteran collaboratives.
It's become a big issue in the Assembly. You serve as chair of the Select Committee on Orange County Chronic Homelessness. You're also on the Select Committee on the Los Angeles County homeless issue. Tell me about that issue. You said you learned a lot about it here at the local level. What have you taken to Sacramento in terms of your perspective on it, and what needs to be done, do you believe?
Well, being on local council, city council, 8 years, Fullerton was moving along just as most cities were over 10 years ago. We weren't dealing with homelessness as we are today, but we certainly had a view that things were going to be moving forward. And one of the big issues that happened in Fullerton while I was not only on city council but mayor was the death of Kelly Thomas, who was the schizophrenic man in Fullerton who was killed in downtown Fullerton by police officers. And this really erupted into not only a local but really an international case once the video was released. And it was shocking, and it was very disturbing. And so with that, I moved personally forward towards really focusing on what does Fullerton do well, not just with police enforcement, but also with mental health and with homelessness, because at that point he was homeless. It was quite a change for our community, and it really had a lot of strong feelings that came out after or throughout that year.
And what has been changed or achieved since then?
Well, one of the major issues was really the police department having a really major emphasis of reforming, looking at how they were interacting with people that may have mental illness, focusing on a homeless liaison, looking at practices. I mean, there was an investigator that came in, and there were about 40 recommendations. Many of those have been rectified, but there's always more work to do when it comes to mental health in the community. And that's not just for police officers, it's also for our first responders with firefighters, public school teachers, really even community members, because we are seeing more and more cases where people that may be struggling with mental health are interfacing with people in restaurants, bathrooms, other places.
So you've been exposed to and dealt with behavioral health issues both as a teacher and also at the local government level on the city council and as mayor, and are now dealing with that in Sacramento. What about on a personal level? What experiences have you had with behavioral health, and how has that impacted your outlook?
Personally, very much. I lost a brother this last October, hasn't even been a year yet, who struggled with alcoholism and was in and out of being homeless. And although in many ways I felt like we had some tools because of the work I had done, we realized that it is very, very difficult to work with somebody who's struggling with addictions and other issues to just fix it. And many times I think what is recommended are short-term fixes, and for many who are struggling, it may take a year or 2 years, and sometimes somebody who is struggling may take 3-4 steps forward and then go backwards. And in my brother's case, he, for the first time after many years, was starting to move forward and accept help, but he had kind of backstepped, and actually when he died in October, it's because he had been drinking and basically rode out in front of a car and was hit by a car. So that being said, that's one of the personal, but every family, when I shared my brother's story and simply called it Billy's story, I literally had hundreds of people because it was put on Facebook and shared on publicly, and people of all backgrounds texting me saying they have a family member struggling, and they're struggling because they just don't know what to do. And I think it's a very, very big issue, not only for the person suffering, but also the family that is trying to really do what they can. I know with Kelly Thomas, his mother, she really was out there driving around looking for him, trying to find. My mother did that as well. And it's just very painful for everybody.
How was your family affected by your brother's struggle?
Well, it wasn't just when he died that you're affected. It's throughout all the years that they're really suffering. In many ways, I mean, you grapple with it as how much, like in many ways, it's how much do you keep doing for somebody? When do you try to get outside help? And if they don't respond to that. So it was a very different way because we have a large family that we each individually dealt with it. My mother, who's 84 now, really spent the most time driving him from place to place, trying to, do what she could, but we all did. And it has been very difficult since he's passed because everybody deals with it a little different. Like, could you have done more? All of these things that I think families out there are struggling with of how do you solve this?
People always second guess themselves. What could they do differently? Do you think it's been easier, though, since you've been able to talk about it? Because we talked earlier about stigma is such a real thing, and for so long people were just unwilling to talk about it, and therefore people weren't getting the help that maybe they needed.
I think it has. I know that, this happened in October as far as him dying, and I didn't talk about it a lot before then. But I know that when I spoke about it actually publicly, it was at Cal Optima. We were talking about Fairview, and I wasn't surprised, but I was very, very emotional about it. And I think that those are the things that happen when you go through a death of somebody that you've been trying to help, that sometimes you are very pragmatic about it, and other times and so we're still dealing with it, in the sense of my mother particularly. I think her job in the end became taking care of him. And now that he is not there, she's struggling to know what her job is.
Yeah, suddenly the role has changed to a large degree.
Right.
Well, the Behavioral Health Action Coalition that we work with is really interested, obviously, in elevating this issue and educating people about it. And I think one of the things that they talk about is that you have these separate forms of healthcare delivery, brain health versus physical health, that they're not really integrated well, that they're separated. What's wrong with that system, and how should that be changed?
Well, that is one thing that I really have found out, even though I felt like I had a little bit of a background working with some agencies with the collaborative, and then as a teacher, and again, going to the state looking at this issue. But since my brother has passed away, I've really become much more focused on it, and I really feel like it's almost like an onion where you're peeling, and you find other layers and other layers. And what I'd say is there's a lot of great organizations doing good work, but they're not talking to each other. And that is not unusual in major organizations, whether it be schools, teachers talk to teachers, principals talk to principals. But we have, I think, the means to help more people. But until I really believe truly David Carter came upon the issue on with the homeless that were on the banks of our riverbed, that he has forced groups to talk. He has forced cities and mental health and behavioral health and hospitals and local public safety to really deal with some of the things that haven't been dealt with. And for the first time, I feel like people are starting to get to know providers that they've never even new were there. So we had a lot of people trying to do work on small scales versus a comprehensive way. One of the biggest is, I think, CalOptima, in the sense that they are a health provider, but we've seen over 400 people die in Orange County in the last year and a half. And with that information, one of the kind of investigative parts is why. Why? I mean, we know people being outside for a period of time, they're going to get sick, but we also know we have this chronic in and out of emergency rooms and police department and county jail. So by the judge really bringing them in, I think that there's now the space for them and other hospitals to say, we have a real serious crisis, and now how are we going to respond to it?
Well, at the state level, as of January, we have a new governor who has spoken quite a bit about his interest in behavioral health, and of course, a new crop of lawmakers as well. Are we at a tipping point right now in terms of changing the way this has been going and to move towards a more comprehensive and more connected healthcare system, do you believe?
I do believe we are. I still believe, though, even though it's being talked about, like you say, more publicly, there's more people at the table, we're still going to have to be incredibly diligent and forceful about not taking one or two wins, maybe a center that's opened up and feeling like, okay, we have this solved. I just was in Los Angeles 2 times this weekend, and it's very clear to me that they have a huge issue on their hand. Orange County doubling their homeless, and with not all homeless are mentally ill, but some are, that we have a problem. But I'm very optimistic that in Orange County, if we continue to really make this a priority, as it has been in this last year, we're within reach of solving it. I mean, there's some estimates of about 7,000 people being homeless in Orange County. You know, I think it could be more than that, but I don't think we have any space or time to delay or figure out ways to not solve it, because we will not be in a place to keep it under control. We see examples with San Diego, San Francisco, and Los Angeles, and that can happen very quickly.
So you mentioned what the judge has done here locally. When you think back to your experience in the classroom and then at the local level in dealing with these issues, what's a good concrete step forward that the state could take, do you think?
Well, the state has definitely put up many dollars or funds to provide not only funds for emergency shelters, funds for permanent supportive housing, but it's also the healthcare part of it that we really have to be serious about. And that is, as we talk about behavioral health, understanding that this isn't a 2-month or a 90-day program or a sober living program. Those that suffer from mental health, we may have to look to some long-term solutions. So as the state has surplus property, and in Costa Mesa we have 18 acres of property on the Fairview Hospital grounds, looking at that in a serious way as a beginning of maybe a long-term plan to house some very severely mentally ill, not as a homeless shelter, but as a place. And right now, in the language we put forward, there is a plan to move forward with 200 beds for severely mentally ill with wraparound services.
And of course, with the budget the way it is, the state does have the resources now to invest in these kinds of things. What about the importance of being proactive and trying to deal with it on the front end, the intervention end, as opposed to dealing with it on the back end? How important is that?
I think very important. So whether it be kids getting into gangs because they're left alone, whether it be preventing, we're talking about more younger and younger, particularly girls suffering from depression, A lot of these things, we can't say exactly why, but we know some of the things that we have been doing, whether it's medication and so forth, don't always work. So I think when we start to look at how do we get, whether it be young men or women, more engaged physically, looking at the kinds of foods they're eating, looking at what they're exposed to. Social media has a big impact on particularly young girls. I went on a tour to Chalk Hospital where they have the new adolescent wing, and asked one of the directors, it's great that they have it, but why? And she said, we have more and more young girls and young men attempting suicide, having eating disorders, and even, of course, being depressed. So getting to that, making opportunities for education for parents, making sure that they're understanding that there can be issues or scenarios that can really impact people. And now more than ever, with all of the issues we're seeing with guns, this can really be something that mentally can scar somebody, very much the way you would see a veterans with PTSD. We know that some of the people, it is not just the people that are killed in these horrific gun shootings, but it's all the people that are there and that are exposed to that, and that for one moment think that they might not be able to survive, and then that's repeated. And so we not only have to do more to support that type of individual that's been exposed, but also encourage people to go into the public health as far as education, because I know at the county, whether it be social work, whether it be mental health, we have a lot of our employees aging out. So we have to do more to encourage them to go into the mental health fields.
Did the Chalk tour surprise you? I mean, to some degree, you were aware of some of that. But when you think the amount of children that are suffering from these kinds of conditions, what's the lesson you took away from that?
It did. I was very surprised because I specifically asked why, and that, again, in Orange County is a little bit of the kind of two-sided look of Orange County, where we kind of have Orange County housewives and all the kind of reality TV, and yet, in the same area, you're having young kids that are committing suicide and so forth. And I think that we just are in a period where we all don't know what images and what type of content is flowing into and how people are making that out. I know some have said, well, these shooters that we're dealing with major crimes are all mentally ill. We don't know that that's necessarily true. We don't know that there's other things that are moving them to want to do these, but we do know the effects of it can really, really terrify, whether it be young students on campuses, whether it be anybody who going to a concert. That's why I was in LA. I was up at a concert, and I have to say, not at least once or twice you think of being in a big group like that now, where that wouldn't have happened, 6 months ago.
Well, the Behavioral Health Action Coalition really is interested in coming up with a better system for delivery of healthcare services, more connected, more integrated, obviously. I'm curious, how can that coalition work with you, do you believe? What would you like to say to the coalition in terms of working with them?
Well, I think that one of the things that a lot of times we hear at the state and even local government and schools as well, we don't have the resources, or we have a lack of funding. So early on, I know particularly in schools, it's not common to have a counselor on campuses. And if they do have a counselor in the high school, typically they're academic counselors. So we definitely don't have that support for the younger students. We did a telehealth bill that did pass and get signed, and that is for public schools to start to set the stage for in the future, could we have students have the opportunity to, when they're in a crisis, be able to use telehealth and get on and have somebody there? So those are some options, but I think the biggest thing is people have to know what the other end is doing. So an example, like I said, is hospitals never really talked about working closely with police or with, if you want to say, cities. And now that conversation is, I think, imperative as hospitals are dealing with many times people walking in that have severe mental health issues, and they're the ones having to first deal with that. They're nurses, they're doctors, but then at some point police are there, and then where are they going to be after they've been there for a day? Where do they go? All of these issues. But even the county, I know that are opening up quite a few mental health beds in the jail. And this is, they've always separated the mental health patients from the other inmates, but they really didn't have any program for them. And now one of the things under Sheriff Don Barnes is they are going to be using some of the mental health funds to work with inmates while they're in there, and then try to develop a plan as they exit versus just exiting to a park or so I think these type of partnerships, relationships, and then of course you have the new model that the county is bringing forward with the Minds OC, which will be built in Orange. The county is funding it indirectly through the state because the state gives mental health dollars, and that will be a 90-day program.
A lot to talk about. Assemblywoman Sharon Quirk Silva, thank you so much for your time. Appreciate the insights.
Thank you so much.
And thank you for joining us for Behavioral Health Champions, a production of the Behavioral Health Action Coalition, an organization that's committed to raising awareness of this issue statewide. Thanks for watching.